While a quick diagnosis is definitely important to treating these guys, picking the correct empirical antibiotic also has a huge part in this. If you're new here, welcome! I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. I was recently asked if kidney infections are the #1 cause of decompensation in chronic kidney disease cats. And that's a really good question. The short scientific answer is no. However, pyelonephritis is notoriously difficult to diagnose, making it likely that it's underreported. A study published in 2020 looked at 100 different cats, and it listed pyelonephritis as the third most common reason for acute kidney injury, right behind renal ischemia and ureteral obstruction. But let's back up. If you haven't watched my video on whether or not your cat truly has chronic kidney disease, I would recommend you go back to that video so that you understand the difference between acute, chronic, and acute on chronic kidney disease. Now, what is pyelonephritis? Pyelonephritis is simply a very fancy word for a bacterial infection localized to one or both kidneys. Because it's so localized to the kidney, it's very difficult to diagnose with our standard tests. Oftentimes we need to look at blood work, urinalysis, urine culture, sometimes abdominal ultrasound, multiple different diagnostics to basically build the case that we have pyelonephritis present. Unfortunately, these kidney infections don't come with a standard set of clinical signs either. Some cats present simply with weight loss, others aren't eating or have vomiting and other clinical signs. Some cats I've seen just aren't using the litter box anymore. On the opposite end of this spectrum, a urinary obstruction is pretty obvious and oftentimes easier to find. Regardless of whether pyelonephritis is the #1 cause of decompensation in these cats, it falls into the category of an acute kidney injury. And in a cat that is already suffering chronic kidney disease, it can definitely be a life-threatening complication. According to a study published in 2023, female senior cats have a much higher likelihood of developing pyelonephritis as a secondary problem. In that particular study, the bacteria that was most commonly cultured was E. coli. Now that wasn't necessarily a surprise. E. coli is a major offender when it comes to urinary tract infections. The surprise came when this particular E. coli was tested against antibiotics. And one of the most common antibiotics used to treat empirically, meaning we know we have a urinary tract problem, but we don't know what the bacteria is yet. One of the antibiotics that we choose very, very routinely, this particular E. coli species was resistant to. So as if it's not hard enough to choose an appropriate empirical antibiotic, because cats don't have a lot of studies, we don't know about duration, we just don't have enough evidence. Now one of the ones that we choose very commonly is showing a lot of resistance. This highlights the need for further studies, different empirical antibiotic selection, and urine cultures when we suspect these problems. So back to the original question of, is pyelonephritis the #1 cause of decompensation in cats with chronic kidney disease? And again, the data says no. I'm on the fence. It's definitely up there as a problem and a complication. Interestingly enough, in my experience, it also seems to depend on your location. Now, I don't know that that's physical location versus the clinic you're at versus the level of medicine or all of the variables that go with it. But there was a clinic that I worked at that I saw these cats all the time. Every cat had a kidney infection. And then there was a different clinic I worked at that we rarely saw cats with kidney infections. Now, the level and quality of medicine between the two clinics was very similar. They were very high quality clinics. Same with the clientele. So I don't necessarily have an answer as to why that's the case or why we were seeing that, but it is something to keep in mind, and who knows, maybe another reason to do a study. On the bright side, when compared to other causes of acute kidney injury in cats with chronic kidney disease, pyelonephritis has a higher survival rate than previously thought. While a quick diagnosis is definitely important to treating these guys, picking the correct empirical antibiotic also has a huge part in this. Don't forget to hit the like, share, and subscribe buttons if you enjoy this type of content. Or even hit me up with a question below in the comments.